I'm Muriel Bowser. I'm the mayor of Washington, D.C. I am providing a situational update on the district's response to COVID-19. We are located in the John A. Wilson building. I'm joined today by members of my team to assist with this briefing and answer your questions. First, City Administrator Kevin Donahue, Dr. Anjali Tallwalker, Chief Science Officer at DC Health, Patrick Ashley, Deputy Director at DC Health, State Superintendent for Education Christina Grant, and DC Public Schools Chancellor Dr. Louis Farably. We are addressing what our nation is experiencing with the rapid evolving cases related to COVID-19 and the Omicron variant, as well as adjusting the district's posture as COVID-19 evolves in our city. But we want to stress, and I want to start by saying how important it is, and we will explain the disparate outcomes related to those who are vaccinated and boosted, those who are vaccinated and those who are not vaccinated as we experience this winter surge. So if you have friends and family who need to be vaccinated, please take a moment to make calls to them, let them know about the resources available across the city so that they can get vaccinated. If you have not received your booster, please follow the same resource avenues to get your booster and to get it right away. If your children haven't been vaccinated, children 5 years and older are eligible for safe and free vaccines. So please find out where you can have your children vaccinated. I want to move on now to talk about the district's experience with the Omicron variant on slide 2. And I'm going to ask Dr. Tallwalker to talk about this briefly.
Thank you, Mayor. So we want to do a little bit of context setting. I think we had been talking about the emergence of variants of concern. We've been talking about a potential surge come the winter, and we're here now. So people saw at the end of last week rises in our case numbers that we haven't seen before. It is appropriate to be concerned when we see numbers like that, but we also can have confidence in the tools that we have that we know work to contain the spread of Omicron and of COVID-19. So we're going to get into some of that in a little bit. So the global genomic surveillance system detected the latest variant of concern, Omicron, at the end of November. The first case was reported December 1st in the United States, so we knew it was here. It has since been reported in 45 states and the District of Columbia. Currently, Delta is still the predominant variant. It's about 97% of cases in the country are Delta. Omicron accounts for about 3%. It does vary by region, and we expect all of this to change over the coming weeks. So right now in our region, around DC, it's about less than 1% are Omicron. Of course, sequencing data lags a little bit behind our case data because it takes a little bit more time to actually sequence the genome than it does just to detect virus or the nucleic acid. So we expect to see that number, that proportion that's Omicron, to increase in the coming weeks. Looking at some of our metrics, you can see with our daily and our weekly case rates, compared to 1 month ago, we're about 4-fold higher at that point. In terms of hospitalizations, we're holding steady at around 5%, and our vaccination numbers help with that. So 65% of our population are currently fully vaccinated. And if we move to the next slide, I think this is really where we want to put people's attention, the difference between unvaccinated and fully vaccinated, and even in the age of Omicron, right? So our case rates for the unvaccinated are about 7 times higher than the case rate for fully vaccinated, which the definition of fully vaccinated is 2 doses. So they are still faring much better in terms of rates of infection, and that's something that we continue to monitor. When we also look at hospitalization data, hospitalization rates are 5 times more likely in the unvaccinated than the vaccinated. So vaccines are still the tool. It is critical if you are age 5 and over, get vaccinated now. If you are age 16 or over and had a Moderna or a Moderna or Pfizer what's the date today, before June 20th, or a Johnson & Johnson before October 20th, it's time to get boosted. It's not too late. Now is the time. There's vaccine available.
So thank you, Dr. Talwalker, and the doctor will be, of course, available for questions around how we're monitoring all of the variants and planning accordingly, as well as to talk more about the experience that people who are unvaccinated are having, primarily the people who are unvaccinated are having with hospitalizations in our system. As was just mentioned, is faring very well so far with hospitalizations. But it is important that people continue to get vaccinated and get boosted. We talked a couple of weeks ago about our surge planning for the winter, and I want to update that. I will be declaring a state of emergency today that is primarily to expand our administrative tools to make sure that we can do all the things that we need to do administratively, including buy goods and services, and make sure that we're handling DC government operations in an urgent way. We are going to talk today about expanded testing. I will reinstate a citywide mask order. We will be instituting a DC government vaccine mandate to include boosters. We will talk about a January launch of COVID-19 testing and vaccination centers. Our public education officials will talk about winter break and how we are proceeding with the distribution of rapid tests. And we will, of course, talk about what we all can do to keep our families, ourselves, and our community safe. So with that, I'm going to ask Patrick Ashley at DC Health to talk about our testing capabilities.
Thank you, Mayor, and good morning. On the chart, you can see here, we have been seeing our seasonal rise of testing, and so those are the gray bars you see on the chart. We do see every holiday season and every peak travel period where we see an increase in testing, both related to individuals wanting to do their part and understand their status before they're going home and traveling or after traveling. We're always seeing a demand in testing. We also started to see a spike in demand as we saw cases rise, and people wanted to know their status in the community. So right now we're about 15,000 tests per day. We are seeing that about a third of those tests come from district-operated public testing sites or Test Yourself DC sites. And as you can see from the black line on the bottom, that is our percent positivity rate. And as we see more spread in the community, we anticipate that the positivity rate is going to increase in the community as well. We've talked a lot about the positivity rate over the course of the pandemic, especially now as we're talking about rapid antigen test kits. And so we've called on the city to make sure that individuals are reporting those rapid test kits, and we'll talk more about that. But we don't necessarily have a full picture of the positivity rate because many of these tests are administered over the counter. We know that the testing sites are very important to the public, and so we've got a number of testing sites available throughout the community, most notably our Firehouse testing program that we've been operating since last year. The schedule is up on the screen. We also have a number of pop-up testing sites that are available throughout the community as well, and you can find all of those on coronavirus.dc.gov. Those rotate throughout the city, and we'll continue to publish those. Those are tests that are collected by a health professional, and so we also have options for individuals to do the Test Yourself program. And so we're excited to announce that as of noon today, we will expand the Test Yourself program to have an additional 9 sites available throughout the community. We've also been working hard to keep up with the holiday demand for tests, and we have enough tests available in the community to serve everyone that wants a test. And so you'll see more tests out in the community in the coming days. As we move forward, we've talked a lot about antigen test kits, and we've talked about how that our neighbors in Maryland and Virginia have offered antigen test kits, and we're excited today to talk about our antigen test kit program. So we have ordered over 1 million rapid antigen test kits. We have 42,000 of those on hand right now. We have approximately 200,000 that we have confirmed is in transit and on the way to DC. And the remainder of those we expect in the next 3 to 4 weeks to come here into DC. 150,000 of those are a kit made by Binex Now, made by Abbott, and 900,000 of them are a kit made by iHealth. Both are FDA approved. So starting this Wednesday, we will be able to offer those to individuals, to DC residents, across 8 locations in the city. And we know antigen test kits are important because they provide fast and accurate ways to know your status. But there are also times and places to continue to do PCR-based testing. And so we'll talk more about that and have information out available about when to take a PCR test and when to take an antigen test kit. So a little bit about the details of that program, or Test Yourself Express, as we're calling that. We do have those at 8 district libraries, and they'll be available 6 days a week, Monday through Saturday. We will initially have 1,000 kits per library per day, and more available as the supply increases. As I mentioned, we have more on the way. And so we have plenty of supply right now to handle that 1,000 kits. It's important to note that each kit contains 2 tests in it. So individuals, we do ask them just to take what they need to determine their status, and be friendly to their neighbors and make sure that they leave supplies behind for individuals to be able to be tested. And that's for our Test Yourself program, as well as our Test Yourself Express program. With that, residents can get 2 free rapid tests, or 2 kits per day. And so that's a total of 2 kits, or 4 total kits, or 4 total tests, excuse me. It is limited right now to DC residents, and so DC residents must bring some form of identification with them that proves that they're a district resident. That could be a DC ID, that could be a piece of mail with a DC address, many of the same things that we talked about with vaccination. We know that our neighbors in Virginia and Maryland also have programs, and so hopefully we'll be able to have plenty for everyone that's interested, or we can refer them back to their home jurisdiction for those kits. So as I talked about, it's important for us to know the status of who is testing in the community, both positives and negatives. And so we encourage individuals, whether they're getting these test kits from our Test Yourself Express program, or picking them up from their local pharmacy, or many of the other locations that they're getting these tests from, is to be able to report that information to us. And that's coronavirus.dc.gov/over-the-counter. It's a simple, quick form that you fill out that allows you to provide us some demographic information about yourself, as well as whether you tested positive or negative. Individuals that test positive will be entered into our contact tracing system, just as if they were tested at any other laboratory. And so we'll be able to collect that data and have better understanding of who in the community is testing positive. On the screen, you'll see the 8 initial Test Yourself Express locations at 8 libraries, 1 in each ward. As a reminder, this does start this Wednesday, December 22nd, at the hours listed on the screen. And so it'll be the same hours for each site. I do want to note that these vary just slightly from the library hours. And so just pay note or pay attention here to the hours of operation. So just as a reminder, the 4 ways for individuals to get a test in the community. You can always go to one of our district-operated walk-up sites for that free PCR test. We've been asked a lot about what is the test turnaround time. We know that citywide right now we're seeing test turnaround times about 1.5 days across all of our test providers. And so we want to make sure individuals are getting results back quickly. But again, we'll have information about when it's appropriate to take a PCR test, and when it's appropriate to take an antigen test. You can also pick up one of the free PCR test kits at one of our now 36 Test Yourself DC libraries or recreation centers. And so that provides an opportunity that you can pick one of them up, test yourself. You can hold on to that for a couple of days. We do collect from the Test Yourself locations 7 days a week. And you're available to pick up those test kits at the library hours and DPR recreation centers. The third way to get tested is that you can pick up one of the free rapid antigen test kits at one of our Test Yourself Express sites, or finally, you can make an appointment with your healthcare provider. As I mentioned, about 1/3 of our testing volume comes from public operated sites, but there are many opportunities in the district to get tested through healthcare providers. Thank you, Mayor.
Thank you, Patrick. So please make sure that you are availing yourselves of one of those opportunities. Walk-up sites, get your free test yourself kits, which have been increasing in popularity, and our turnaround has been very, very favorable. And so pick up your antigen just starting on Wednesday or make an appointment with your healthcare provider. Next, as I mentioned, we will be dialing up our mask guidance from the mask advisory that has been in place to the mask mandate beginning tomorrow at 6 a.m. And I will issue a mayor's order that leaves that mask mandate in place through the month of January until January 31st. We are also dialing up our, as we have discussed previously, our vaccine mandate for DC government workers. All employees will be required to be fully vaccinated against COVID-19 and get a booster. And we will no longer offer our employees the ability to test out of that mandate. We'll, after some detailed discussions with our labor partners, have a specific deadline for our employees to comply. Further, we will be opening some fixed locations throughout the district for testing and vaccination to be supported by DC Health. We are seeking retail locations in all 8 wards. So I am inviting property owners who have such a space that they would be willing to lease to the district to email us at retailspace.dc.gov. We have some great leads, and we want to have those wrapped up and staffed by mid-January. So we will continue to keep you up to date on that. I now want to turn to our District of Columbia Public Schools. I also want to acknowledge we've been joined by Michelle Walker-Davis, who is the Executive Director of our public charter schools and the Public Charter School Board, and she is with us should there be any questions about our public charter schools. Chancellor Farabee is here, and our state superintendent is also here. I want to first talk about our value on public education and our experience throughout COVID and our continued belief that school is the best and safest place for our children. We know what they have lost in being out of school and disconnected from school, and we're going to do everything as a government to keep our children connected. Having said that, we recognize that our school leaders have to operate the buildings and are going to let us know what they need to do that and do that safely. I am going to turn to Chancellor Farabee in just one moment and just remind everybody that we continue to encourage, the CDC continues to encourage in-person instruction, recognizing the loss that children have endured over the last almost 2 years. We are investigating what the CDC's latest guidance about testing to stay, the test to stay guidance. We don't have anything to report on that today, but we are researching how that could impact our schools. So with that, you can go back to the last slide, turn to Chancellor Farabee to talk about DC Public Schools.
Thank you, Mayor. As shared earlier, we will continue to be guided by our value to ensure that our students are loved, challenged, and prepared in our schools, and the belief that our schools are the safest place, the most appropriate place for students to learn. As shared earlier, we are going to leverage the opportunity of access to the antigen-based tests, and this will allow DCPS and our public charter schools to begin testing for students and staff at the return of the winter break. So on the next slide, you can see that we will have access to 100,000 test yourself kits as a part of the rapid and express antigen model that DCPS and the public charter schools will be participating in. And every school whether DCPS or public charter schools, will have access to these rapid tests for every student, teacher, and staff member. As a result, we are modifying the winter break period. So after the winter break, our schools will be closed for non-instructional days on Monday, January 3rd, and Tuesday, January 4th, to allow for distribution and also testing again of students and staff. We will continue to update our community and families on how and when to pick up those tests. And you can go to any of your schools for DCPS specifically. It does not necessarily have to be the school that you attend. You can go to any DCPS school. And again, we encourage all of our family members to participate. And as we always remind our community, we're in this together, and we want to ensure that our family members are smart about their activities during the holidays. Thank you, Mayor.
Thank you, Chancellor. And if I could have you address our current posture, which is the posture like for this week and for the return to school post these 2 days that we switched to basically testing days and testing pickup days. Several of our schools, based on the chancellor's approach to deciding when a school can operate or not, are we have a situational virtual policy. So don't expect for us to say, given exactly where we are now, that all of DC public schools is going to be closed. What we will say, however, is if a school cannot open because of the experience with the virus or some other staffing or operational issues. So if you want to say a little bit more about where we are today, Chancellor, I think that would be helpful.
Yeah, thank you, Mayor. So where we are today is we're continuing our approach to a situational assessment of how we will operate our schools. And that is not new. We've had this approach since we started this school year, and there have been times in which we've had to transition classrooms or grade levels to virtual. Given the magnitude of cases we're seeing now, we are now approaching a time period where there's a three-layered approach to our review process to determine if there's a shift in the entire school operations. First and foremost, as we continue to collaborate with our health officials, and at this time, health officials have not indicated that there's a need to discontinue operations at a school, but we will do assessments case by case at each school. Should DC Health make a recommendation, we will follow that recommendation accordingly. The second layer is continuity of instruction. So there are time periods in which we have a critical mass of students that may have tested positive or are close contacts, and thus may need to transition to a virtual environment. If that is a critical mass that impedes continuity of instruction, we will transition a classroom, a grade level, or a school to a virtual posture for a period of time. And the third layer is our operations. Anytime there is an impact to operations where we're not able to deliver on services as we typically do, then we also consider adjustments to operations for a time period. And again, that could be related to staff members and capacity of close contacts or individuals who tested positive. As soon as decisions are made, we do notify the community, and the expectation is each evening we'll share any adjustments to family. Of course, there will be extenuating circumstances. That there are, we'll again communicate accordingly. Thank you, Mayor.
Okay, thank you, Chancellor. And we're coming up on our last slides. And we're reminding residents of all the things that they can do to keep themselves healthy, their families healthy, and the city healthy. And we've talked many times about layered mitigation strategies, but the foremost, and we can show you again the slide that shows the case experience with COVID for the vaccinated and the unvaccinated. And so it's really, really important that we get vaccinated and boosted. So all people 5 and older are eligible for the vaccine. We have on DC Health's website easy to find ways to get vaccinated, but please get vaccinated. And if you've already had your 2 shots, get your 3rd shot, get your booster. It's very important to keep the experience with COVID diminished, and also our healthcare officials able to take care of Washingtonians who need to be in the hospital. So please listen to that. It's also important to know your status, so get tested. Stay home if you're feeling sick. And anecdotally, we've heard a lot of people experiencing mild symptoms, so they may just think that they have allergies or have a cold, but don't chance it. Stay home if you're sick so you won't spread it, and get tested. If you test positive, stay home and isolate. We're also, as Patrick did earlier, reminding everybody, if you're using an over-the-counter product, to please go to the DC Health website and log your status. It's simple. I've done it. It takes 2 minutes, and you can log your status. Further, wear masks indoors, even if small gatherings. One thing that we're concerned about, as we have been throughout this pandemic, is when people are in non-public settings in their homes where their guards are down, and it is important to think about your safety, even in small gatherings around the holidays. Choose your activities wisely, and you may even consider bowing out of some social events to keep your exposure down. Consider your own risk, the people around you, and the people you might see or you want to see in the coming days. We're asking for help this week. Our Serve DC office has called for volunteers Monday through Wednesday to help assemble COVID at-home test kits. So please be in touch with Serve DC if you are available. So that is our briefing, and I'm happy to answer your questions. Yes, sir.
I was trying to find out, we've seen the long lines at the testing sites. Is there a particular day or time of day where maybe there's less of a wait for folks?
If we could go back to the slide that shows our testing locations. Patrick?
Yeah, thank you for the question. So I think, the fastest way to get tested is Test Yourself DC. You can pick up a test kit, you can do it at your convenience. Many times individuals don't know the difference between Test Yourself DC and our public testing sites. The reality is that it's an identical test. It goes to the same lab on the same day. So you can pick up one of those, test at your convenience. Otherwise, we know that people test a lot after work in the evening hours. We know that people are excited to get tested right now because they're traveling, right? And so they're anxious, and that's understandable. And so we'll see long lines at some of our testing sites. We see that both at our public testing sites as well as our private testing sites throughout the community that we partner with. So just a plug for individuals, making sure that they're patient and they understand that everybody wants to get tested right now. There's plenty of testing capacity, but we do offer a great option, and that is the Test Yourself DC option. You don't have to wait on anybody. You're fully qualified to swab yourself. It's the same test that a professional will do. So, yeah.
Yes.
Mayor Bowser, at this point, do you regret dropping the indoor mask mandate?
I don't regret evolving with the virus, which is exactly what we've done throughout the virus. So as conditions warranted, we've changed our interventions, and we're changing them again.
So is there still a number or metric that you can give to the residents of DC? Obviously, numbers have picked up, but in terms of what's going to drop, what's going to bring it back, is there any number that you could point to on when we're going to switch again in the district?
Is there any number? Say that again.
Any metric that could guide residents on when we're going to go back to dropping the indoor mask mandate?
Sure. So right now we have a time limit on the mask mandate, as I mentioned, that will take us through January 31st. And if we need to keep it on, then we'll re-up it at that time. There are many metrics, and you can go to the metric slide that we are following to see what our experience is with COVID. And all of them are important to the work that DC Health does, but the hospitalizations are critical to understand about how our public health system is performing. And the vaccination numbers, look at this. So the lighter line, the yellow line, are people who are unvaccinated or not fully vaccinated. And that's the case experience. This isn't a hospitalizations chart. This is how many people are getting cases versus the bottom line, the darker line, are the people who are fully vaccinated. And I think this chart would look similar for hospitalizations because the people who are unvaccinated or not fully vaccinated are 5 times more likely to be hospitalized. So those numbers are very critical to what we're following.
Can you talk about this also a little bit more? I know it's kind of mentioned here, but in terms of the spread, or in the school settings especially, are you seeing, the gatherings from outside impacting the high numbers that we're seeing within the school settings, or is this something that's cumulating, building inside the school setting itself?
I don't know that I can specifically answer that for every case at schools, obviously, but we have seen throughout the pandemic that our experience in schools mirrors what we see in the community. So that is not unexpected. But what we also monitor very closely is if we have a case of spread in the schools, and that is a more detailed analysis that our public schools and contact tracers follow. That's important for us to know because it suggests that something in our protocols may be breaking down, and so we examine that very closely. I don't have anything specific to report about that today on any particular school. Yes.
Hi, just to reintroduce myself, Amanda with WANU-DCS. What's the action plan to get more people boosted, especially before Omicron hits? Especially our seniors, I think the CDC is reporting around 45% of those 65 and older are currently boosted. So what is the plan to get those people boosted?
Well, we for sure continue to use every communication method with individuals, and I'm not sure if DC Health can make a comment. We may have to get back to you on recently. The more it's in the news that people should get boosted, the more helpful it is. We'll have some direct communication strategies as well, especially with our congregate settings. We didn't get too much into that today, but we are working on if we need to enhance our strategies for congregate settings. That includes our homes for our seniors and elderly, our own operations, and from our homeless shelters to DC jail, all of those things, we are putting a microscope on to see if we need to enhance any of our strategies.
And
Yes,
just to add to that a little bit, we have close relationships with all of our long-term care facilities. They have had access to vaccine providers through an exchange to be able to get folks on site to vaccinate staff and residents. We're also going to pull some more levers in that space to make sure that the booster rates get up with some of our strike team sort of vaccinators. And we're also looking at our immunization data, specifically at 65 plus, but also 50 and plus, to do some more direct outreach to them to make sure that they know that the message is very clear that they should get boosted. We want everybody over the age of 16 to get boosted, but there is a difference in risk when you talk about over the age of 65 or over the age of 50 with an underlying chronic condition. So we want to make sure those folks, especially before the winter surge, are getting boosted now. So we'll be doing some specific outreach to those groups as well.
Mm-hmm. And people are not only afraid of hospitalization or death, there is a lot of concern about getting long COVID. And so I wonder if you can talk a little bit about that. Like, do we have any data on the percentage of residents who tested positive and got COVID? And then I have just 2 questions about schools after.
Sure. So we're still looking at data around the actual estimates, who's more likely to get long COVID, what sort of the characteristic of that disease process really looks like. So I think there's a lot that we're going to be learning over time, particularly as case counts go up, and whether there's a difference in what long COVID looks like depending on the variant that you were infected with. So, I think what we want to do, time is on our side for the development of treatments for long COVID. We don't want anyone to get infected, but as case counts go up, our priority is to prevent death and to preserve hospital capacity. And if we can keep you well enough and out of the hospital, you'll have time to benefit from treatments that might come kind of down the pike as we learn more and more about long COVID.
Okay. Will students, and just to be clear, will students be required to take a COVID test in order to return to school that Wednesday? Will students, can they opt out of test, or students and staff?
It would be highly encouraged, and the expectation is that all families would participate, but it's not a requirement.
Gotcha. And we're also seeing, right, I believe a record number of quarantines, at least this school year in schools. And so we're hearing anecdotally that some families are keeping their kids home just proactively, not because of any kind of exposure, they're just worried. And I'm wondering, how is that impacting instruction, and what are your plans to address that as more kids stay home?
Yeah, so our attendance trends are very similar, for example, for the month of December that we've seen in the past. So we'll continue to monitor attendance across our system. But as I mentioned earlier, how we evaluate our situational transitions to virtual will be dictated by information and guidance from our health agencies, and then also we'll consider continuity of instruction along with capacity for operations.
Thank you.
Yes, Michael.
Hey, Mayor. I'm wondering if you all have considered vaccine requirements for indoor venues or restaurants as part of this new program.
Yes, we have, and we continue to invest in learning how that's going to affect us right now in this surge.
Okay, but nothing right now.
Not today.
Okay. And then DC stopped reporting test turnaround time for people who are worried about getting tests in time for Christmas and seeing family over the holidays. Can you specify or indicate what the average test turnaround time is right now?
Sure. Patrick, do you have that?
I do. So the current test turnaround time is 1.5 days, or right around 1.5 days. And part of the reason we stopped reporting that was to provide simpler metrics for people to follow along. I'll point you back to the metric as of September 1st, which was 1.9 days. And so even though we're seeing higher testing rates right now as compared to September 1st, we're seeing higher test capacity in the community. And it's been that way consistently for the last 3 months. We have invested across the United States and here in DC in tremendous test processing capacity.
Thanks. And a follow-up data question. Would you all consider reporting data 7 days a week at this point, considering some of the interest in the numbers?
So I think as we follow the winter surge, we definitely will keep all of our options open as to what is the best way to look at this data where it's actually going to affect or inform policy or outreach to residents. Whether 7 days makes a difference to that versus 5 days, we tend to be able to know on a Friday what it's going to look like on Monday. But that's certainly something that we'll continue to visit as the weeks evolve.
Okay, thanks. And a quick question about schools, I guess for the Chancellor. I've seen a lot of confusion among parents and the public on what metrics are being used to decide when to close schools, when to make them virtual. I guess, could you please give us some insight into what goes into that decision making when it comes to shifting schools to virtual operations in the short term?
Yeah, again, I'll just repeat what I shared earlier, is we first look to our health agencies to give us any guidance on any spread that would require us to transition to a virtual environment for a school or grade level or classroom. Right now, I want to remind everyone that the CDC has been very clear that the expectation is that we continue to operate schools, and there's no other guidance that we don't do so. But secondly, we also review continuity of instruction. So if there's a critical mass of students at a school that need to be out that related to COVID reasons or other reasons, that would certainly impact our operations, and we evaluate that daily. And then finally, we also look at capacity for operations, primarily in staffing and other areas.
Yes. So you haven't had a chance, or have you? Okay. Then 1, 2, and Mark.
Okay, thank you, Mayor. I think this is for Team DC Health.
Okay.
So in the past, 3 days, about 30 different bars and restaurants have closed after an exposure or positive test among staff, and that's great that they're being transparent. But unfortunately, my inbox is filling up with workers who are saying that there are lots of positive tests and exposures, and their place of business is not closing. So I was wondering if you could provide a refresher on what the protocol should be, and maybe who these workers should call if they want to report what's going on.
Sure, thank you for that question. So the consult process does sort of vary depending on what our case counts look like. So we are moving into a surge protocol given the volume that we're seeing. We still see the most consults coming from more congregate settings, so universities, also schools and childcares, and healthcare facilities, places like that. So when there's an individual business that reports a case, it's really going to depend on what the exposure risk is. There's not really a one-size-fits-all for every organization because it depends on the number of staff and what kind of interaction we're talking about. So the guidance is out on our website. That's been out there all along in terms of what a business can do when there is a case, what the contact should be for close contacts, what the letters look like. All of those templates are out there. So that is really what people should be following, especially as we go in to the winter surge months where we will be needing to prioritize where we do where DC Health does its own follow-up. But all of the information should be out there is out there for business owners to be able to make the best decisions for themselves.
So do you think that these temporary closures are a good thing and people should do that if they have, a significant number of staff who've tested positive?
So if it meets the criteria that we've laid out on our website, then yeah, they're absolutely doing the right thing.
Thank you.
Mm-hmm. Stephanie and then Mark.
Mayor Bowser, there's been some concerns raised about DC Fire and EMS dealing with staffing shortages before, and now with the Omicron variant and the surge, that things are getting even worse. That more members are testing positive. The mandatory overtime is stretching 36 hours or more. That ambulances are getting stuck in hospitals, and that just this past weekend, DC Fire and EMS didn't have enough people to staff 7 ambulances and 2 medics. And now you're looking at a new mandatory vaccine mandate with a booster required. What are your concerns here with DC Fire not being able to address or serve the community, and are you working with that office to help in any way? Or
Well, of course, we're concerned about all of our operations, but especially our frontline workers. And DC Fire and EMS has always been a part of our no test out protocol. So I'm happy to say that our firefighters and EMS personnel are vaccinated. We will provide updates to all of our personnel about when they need to comply with the 3rd shot policy that I'm instituting today. And we'll do that. I'm going to ask Kevin to talk about what our contingency plans are if we have people who are not able to work.
So since the beginning of the pandemic, Fire EMS had put together contingency plans. This is back in March of 2020 when we really didn't know what to expect, anticipating they might lose 10% or 20% or 30% of their staff. So over the past 20 months has been trying for all the members who work very hard in difficult conditions. And what you're seeing now is implementing some of those contingency plans. You identified one, which is mandatory overtime, which does stretch people thin, who've been working a lot over 20 months. The other that makes us uniquely positioned to be resilient is the fact that we have a significant contract for supplementary ambulance services out of AMR. So when we do reach a point where we have to turn ambulances off, we can supplement with AMR, and we make use of overtime. The third element that you highlighted in your question is that Fire EMS not only responds to capacity based on calls and members, but also how long their ambulances are at hospitals. And we talk globally about the shortage of labor and staffing that we see, and there's connections that have ripple effects throughout the entire system. So an ambulance are in fact at hospitals longer than they typically have been. They generally, historically, spend about 45 minutes dropping a patient. We've seen that go up to about 75 minutes. So all these things are connected, and they're all part of the plan that Chief Donnelly and his team have in place and have had in place since March of 2020. And so they're working through it, and people should still expect to get ambulance service when they call 911, and they'll continue to implement their contingency plan.
Mark?
If I could just stay with that, if you may, just follow up. So can you confirm that on Friday there were 9 transport units that were out of service due to lack of staff because of COVID call-ins?
I would want to make sure I get the exact number for you from Chief Donnelly and Fire EMS. So I don't want to confirm that right now, but I'm sure it's something I'll be able to do shortly after the presentation.
And our mandatory, we're hearing that mandatory holdover notices are a daily occurrence. Is that true?
The mandatory holdovers are daily. Now, I'll give you some context. What we're seeing in DC from talking to the chief and who talks to his regional partners is less significant than what they're having to do in the region. The edge on that's taken off by the fact that we are able to supplement with AMR resources. But since the beginning of the pandemic, firefighters and EMTs and paramedics have been at the forefront of putting themselves at risk in doing their work. And they've done so bravely and will continue to make modifications if they see case rates go up and staff shortages occur.
And then, if I could stay with you, Deputy Mayor, can you tell us, was there a ransomware attack on the DC FEMS personnel database or?
No, there was a global ransomware attack or a global hack of a global time management system that is an industry standard around the world called Kronos. One of the clients of their many, many clients is Fire EMS. Another is actually our OSSI DOT bus drivers. So what this means is they have to change their timekeeping protocols to by hand timekeeping, which they train for in contingency planning. But there was not a hack of FEMS, there was a hack of a global system that's affected clients all around the world.
Does that impact your ability to contact trace when?
You know, when I asked that question myself of our team, it can have an effect, but you know, over the past 10 minutes, we've talked about hospital turnaround times for ambulances, overtime, staff shortages. It's not at the scale of an impact of, like, it's an impact, but not a significant one. Certainly not to the other factors that we've just been talking about.
And then, Dr. Kirby, if I could ask you about schools, and I apologize for not knowing, DC's public schools, are they still in session? Is winter break started? They're in class today?
DC Public Schools is still in session until December the 22nd.
Wednesday.
Okay, and so can you tell us how many schools are closed and moved to virtual learning, the entire schools right now?
We have 3 schools where the entire school are transitioning virtual. And Mark, I'm glad you asked that question because it provides some context of where we are. And where we see cases, we respond accordingly, but that is not the posture of the majority of our schools. In fact, over 90 of our 117 schools have seen, on average, 1 case or less over the past 10 days. And so we will continue to respond accordingly, but we also know that school is the best place for students to be right now and to learn and be supported. And we will continue to keep them in school and support them along the way as we close out our break for winter.
And then can you tell parents, again, I apologize if you told us earlier and I missed it, when and how they can pick up these test kits?
Say that again?
Could you remind parents when and how they can pick up the test kits?
Yes, so let me go back. So on the testing kits, we will have access between DCPS and the public charter schools, 100,000 kits. They will have access to them on January 3rd and January 4th, and schools will communicate directly to families on the logistics of how to pick them up.
But it'll be January 3rd and 4th will be the pickup dates.
That is
And
correct.
that's why schools are closed,
Correct.
to make that opportunity available.
Correct.
And then,
And I want to be clear, actually there are 4 schools that are closed at this point for transition
and you'll
to
tell us the
virtual.
schools?
There is Turner Elementary School, Bard Early College, Watkins, and McKinley Tech.
Whittier?
Oh, Whittier was last week. Yeah, we made a decision on Whittier last week.
So they've resumed classes at Whittier?
They have not resumed classes there. So, sorry, it's Whittier, McKinley Tech, Bard, and Turner,
Not Watkins.
not Watkins.
Watkins has its own issues.
Excuse me?
Nothing. Patrick, could I ask you about, I got notices from residents that said that they were given notices that they took a test at one of your sites and then got a notice that those test samples were either lost, delayed, or not run through and they should get retested. Can you tell us how big this universe is, what happened there?
Sure. So it's a great question. So last week we did notify about 1,200 individuals that their test results were delayed. All of those individuals have received their results since that time. Testing is not a simple thing. It requires a number of different parties to be involved in the data transfer, the results transfer. And so between 2 of our parties that help us out with this activity, there was some connectivity issues that delayed some of that data moving through to allow those tests to be processed in a timely manner.
And Mayor Bowser, my last question, just for you, what do you say to residents and particularly businesses? I mean, I can already hear the calls that are going to come in from the gyms and the businesses that really feel like they're hit hard by the mask mandate. What do you say to those people who believe in the science, want to do the right thing, but they're frustrated with this back and forth and changes all the time, and they think that it really does hurt their business and that they can operate safely? And I mean, just what do you say to people?
Listen, I think we're all tired of it. I'm tired of it too. But we have to respond to what's happening in our city and what's happening in our nation. And we have to continue to focus on keeping the critical parts of our government open, starting with schools, our other government operations, and making sure our vulnerable populations can be supported as well. And so while we are turning or dialing up one of our interventions, businesses can continue to follow the DC Health guidance and stay open. And so I think that's what we should be focused on. Yes.
Mayor Bowser, on that question about gyms, Virginia, even when they had a mask mandate, made an exception for when you were working out. Have you ever considered doing that? Because at least they found in Virginia they're not high-spreading businesses for COVID.
Well, listen, they also aren't instituting a mask mandate in Virginia. We are doing that today. And so we're making the best decisions for the district right now.
But why not carve out an exception for gyms if no data shows they're high-spreading areas?
They are actually, that's a high-risk activity. Yes.
Oh.
Go ahead.
Not on the topic of COVID, actually.
Okay.
2 Capitol Hill related questions. I'm Liz from the Hill Rag.
Okay.
First, Watkins recently had an incident where students in grade 3 were asked to reenact episodes from the Holocaust. My understanding is that the staff member who has since been suspended, according to the New York Times, had been charged and convicted in 2013 of defrauding another school district. That seems like a sort of a flag of bad behavior. How is it she was hired despite that criminal history?
Yeah, first and foremost, we're very disturbed by the incident that took place with the staff member at Watkins. And as you can tell, it's still top of mind. And we move very quickly and decisively as relates to our discipline. The staff member is currently on leave as we investigate the details. We've also tasked our team to review the hiring process to ensure that our hiring protocols will follow as relates to screening as well.
And under normal circumstances, a criminal background check, that would have stopped her from being hired?
Yeah, we do a thorough background check on all of our employees when they're hired. And again, we're doing an investigation into the hiring process specifically to the staff member.
And a second question, over the last 10 days, 14 days on Capitol Hill, 2 random attacks have happened. A woman was thrown to the ground and had her teeth broken. And yesterday morning, a man and his baby were attacked with bricks. There have been arrests in both those cases, but these random attacks have started to make people feel unsafe. There's talk of local daycares not wanting to take the kids outside. Are you familiar with these cases, Mayor? Do you know if mental health or any other extenuating factors were involved? And what can we do to help these people and prevent these acts of violence?
Well, we certainly want, if there are mental health concerns, and there are increased mental health concerns, let me be clear about that. And we're working very hard to keep people connected to services, in-person services where we can, and that's very important. And they both appear to be random incidences of people with a serious problem that have been apprehended by the police. So what I would say to the community is we're going to continue to have our personnel, Metropolitan Police Department out on our streets patrolling. If you see something or someone who needs some additional services or attention, either mental health or police, don't hesitate to call us. Anyone acting erratically that we can intervene and provide services to before they hurt somebody, we want people to keep their eyes and ears open and call the police. Okay, well, I'll do one last round. I'll start with Michael and then Amanda.
Thanks. I wanted to follow up on the antigen test that will be available soon at libraries. I understand right now people are going to need to provide ID, but what about those who don't have ID or maybe aren't DC residents but are desperate for a test?
This is our approach presently. If and when I suspect our supply gets up, and it'll be ramping up over the weeks ahead, days ahead, we may be able to revisit that. But right now, we're focused on DC residents.
And I wanted to clarify on the return to schools on the days where people can pick up tests, are students required to prove, I think you said this before, I want to clarify, are students required to prove a negative test to return to school after winter break, or the test simply gets available to them?
Students are not required to produce a negative test. However, they're highly encouraged to take advantage of the express testing model that will be available to students and staff on January 3rd and January 4th.
Okay. And I wanted to ask quickly for Kevin Donahue, how will the new mandate for government workers affect currently pending religious exemption requests?
So for an employee who has a religious exemption, chances are they're already subject to a requirement that does not allow for a test out. In other words, they're often, and by and large, are either health workers at fire EMS or DVH, or they're school-based workers. For employees who submitted, we did get employees who submitted religious exemption requests when there was a test out option. And in those cases, whether they get the exemption or not, they still have to test out. So for those employees, and there were about 100 of them at the time, they'll have to resubmit their religious exemption request. But by and large, our exemption requests have been for individuals who don't have a test out option. So as we expand the requirement that does not involve a test out, we were likely to get additional requests from medical or religious exemptions that we will work through judiciously.
And do you have the latest numbers on those exemption requests?
I try not to come to a press briefing without them. Across the whole city, so all DC government, there have been 866 requests for religious exemption and 75 medical exemption requests. Across the whole city, of those 866, 149 have been denied religious exemption requests, and 1 has been approved. For medical exemption requests, there have been 75 across the city. 8 have been approved and 13 have been denied, and the balance are still pending review.
Thank you. And I have one last one for the mayor. You've talked a couple times now about choosing carefully about which social events you attend during the holidays. And I saw last week you hosted an event for seniors. And I'm wondering, with the concerns about this variant, if perhaps you have any regrets about that, or if that was misguided.
No, we thought very long and hard about it. And similar to our concerns about keeping in touch with young people, we're concerned about keeping in touch with our seniors for concerns around isolation, nutrition, staying connected to other services. So we have a lot of focus on staying in touch with people. We also are very focused on making sure that our seniors continue to get information about boosters and testing as well.
Thank you.
Who did I call? I called on Amanda next.
Thank you. Is DC testing 10% of its students each week, which I believe is the goal?
No, it's testing more. Dr. Grant, do you have that? No, we're testing more.
Good afternoon. Thank you, Mayor. Yeah, we are aiming to test 20% across our testing program in schools.
Aiming. So are you meeting that? Is that
I don't have this week's current metric. Last week we were at 17%.
17%? Thank you. And because you're making rapid, can you just explain the difference between rapid tests and PCR, like when, so people don't misuse them when both become available at sites? Are you ready to tell the difference now?
Yeah, thank you for the question. So there are a number of differences between when you want to use it and when you don't want to use it. We're going to make written guidance available, rather not talk about it right here, just so that we make sure that we're very explicitly clear about when that is. We'll have a comparison chart that shows when to use this one and when to use that one. That'll be available at all of our sites and on our website.
Okay, and then just 2 more questions. Are you anticipating?
Before you ask your question, the one thing I will say is if you get tested today and you go out and party all week, it didn't work. You see what I'm saying? So I just, one way that people can misuse it is they get tested and they get their negative result, but they haven't, like, they've been having a full schedule, then it may not be as accurate for the holiday gatherings.
Gotcha. Thank you for that. Are you, two more questions, looking to change the definition of fully vaccinated to include boosters? Is that on the table in terms of encouraging more
I think
people?
that there is some talk about it nationally, and we expect to follow suit. I do think that there is some discussion, and perhaps Dr. Talwalker can talk about the difference we've seen between people who are boosted with Omicron and the 2 shots.
Yeah, thank you for that question. I do think the direction is moving to including that 3rd dose because of Omicron. Right now, the studies that have been done are mostly in the lab, so it's kind of mixing blood in a petri dish. But what that is showing is that the Pfizer and the Moderna does work much better after a booster against Omicron compared to just having a 2nd dose. For Pfizer, it goes from about 35% effective with just 2 doses to almost 70-75% effective. That again is in a lab study, which doesn't include the entire immune response that we do. So the definition is likely going to follow when we have more data. But the evidence right now is looking that a booster is going to help us with Omicron. But 2 doses, we still want the unvaccinated to move to vaccinated is still one of the most important things we got to do.
Gotcha, thank you. And my last question, so WMUDC has reported over the weekend that MPD had tried to terminate at least 24 current officers over criminal misconduct, but an adverse action panel blocked those terminations. And so I wonder, can you comment on that investigation? And then also, are you contemplating, or would you support rather, reforming our current disciplinary process?
We've always been pretty bullish about having the chief of police make termination decisions. So that wouldn't change. And I don't know, Kevin, if you have anything specific to say about this study.
I don't have anything to add to the study. The reforming discipline process at MPD has been a long-held goal and continues to be, and it's something as we work through the next collective bargaining agreement, we expect and hope that the discipline process will be able to be reformed through that negotiation.
And let me add that has been each of the 3 chiefs that have worked in our administration, that has been their goal, long-held goal. Yes.
Well, could I just follow up on that? Because, you know, when the public reads this report and they read the allegations and the charges against these 24 officers, I think the first blush reaction from all of them is, yeah, we don't want those guys with a badge and a gun. I mean, what do you say to the residents? And correct me, I know you will if I'm wrong, but I believe when now Chief Conti was on this board that overruled the decisions to have them terminated, he wasn't chief of police at the time. So I'm wondering, did you know about this when you promoted him to chief? And I mean, are you comfortable with these 24 officers having a badge and gun and full police powers out on the streets?
If they were recommended by the chief of police for termination, then that is what I think should have happened. And of all of the kind of police reform debate, for us, that has been the most important. Having the chief of police be able to, unfettered, you know, according to HR rules and due process and all of that, be able to issue terminations. Similar to what happens in the rest of the government. And so we know, as Kevin has mentioned, this is a long decades of history of how these processes have been rolled into collective bargaining agreements.
And then, could I just 2 quick questions? One, while I'll stay with you, Mayor Bowser, can you comment on the Washington football team's discussions with Virginia about possibly locating the stadium there?
I cannot.
Thank you. And then, Deputy Mayor, I know you have other numbers with you, and I'm glad that you brought them. Could you give us the exemption update for healthcare workers, licensed healthcare workers beyond DC government employees? And can you also update us on the disciplinary numbers for DC government employees?
I do not have the healthcare numbers for non-DC government employees, and also we can see if the health department officials here do. For DC government employees, in terms of discipline. And to give context to everyone, there's multiple steps of discipline. We have to follow the collective bargaining agreements, and generally what that looks like is the first step is notification that you're out of compliance. Then there's sort of typically a written reprimand. Then there is a suspension or forced leave of some kind, followed by leave without pay. So it's typically a graduated process that you can imagine gets a little stronger with each step. There have been 605 people that got in across all of DC government that got to that first level of discipline, which is that formal written notification. And there were 505 people who went to the second step of discipline, which is a written reprimand. The next step would start to be suspensions, where we have 57 individuals across all of government. I don't have the agency specifics broken out right now, that have reached the level of recommending suspension. What we have found and what every jurisdiction has found is individuals start to comply as they go through the discipline process. Not everyone, but we see numbers drop as based on both individuals getting vaccinated and something I've talked about repeatedly. There's also individuals who we find have often been vaccinated for months and just didn't really want to tell their employers, and now they do have to. And so that also explains the drop in numbers that as we go from step to step.
Has any DC government employee been terminated?
No, we've not reached that point in the process where there would be a termination.
And then, just so I have the numbers correct, when you say 605 got the first step, which is just the notification that they're out of compliance, 505 got a written reprimand.
Yes.
Is that 505 of those 605?
It's a very good question. Yes, the 505 is a part of the 605. So you see,
we can assume that 100 people got right with the system.
Got right with the system, and then we're at 57 for that step 3. Now, some of the 505 may hit that step 3, so like, and some will have complied. So it's, but yes, it's a good question. That's, think of it as like the same group moving from step to step, getting smaller with each step.
Thank you.
Thank you, guys.
Can I just add in closing, just to summarize everything, and we know a lot of people out there have gotten a positive test and are experiencing a lot of anxiety about what to do and what it means in their lives. And I want them to know they're certainly in my thoughts as they isolate, take care of themselves, deal with their mental health. That's very, very important, and continue to tune in and follow guidance. So I want our fellow Washingtonians, people in the region, to know that we're thinking about them. I also want to emphasize that keeping our schools open and our kids in challenging, safe environments in their schools is a top priority for our government. We don't have a one-size-fits-all approach. Our school leaders are monitoring and making decisions on a school-by-school basis that makes sense for the experience at that school. That's very important. We've dialed up our mask guidance to a mask mandate, an indoor mask mandate, but also pay attention to your social settings and your family environments and private homes where we frequently let our guard down, and be careful about that. We are dialing up our testing, availability, and I just want to emphasize something that Patrick said earlier. You don't have to stand in line at a walk-up testing site. You can go to a library, get a test yourself kit, and you're probably going to get your results in about the same time. Is that right, Patrick?
Absolutely.
Okay, so you can stand in line if you want to, or you can go to the library, do your self-swab, drop it off at the library, and get your results in about 1.5 days. We will provide, beginning Wednesday, some additional rapid tests for DC residents at several locations. If you're using a rapid test, please report your results to coronavirus.dc.gov/over-the-counter. Finally, and I probably should have started with this, and we can go to the slide, please, about what it means when you're vaccinated and dealing with COVID, and what it means if you're not. And that's a very stark difference. The bottom line represents people who are vaccinated in their experience with COVID, even Omicron, and the top line represents people who are not. Those are cases. The hospitalizations chart is very similar. Our hospitals are going to fill with people who have not been vaccinated. So get vaccinated, get your booster, and protect yourself using all of the layered mitigation strategies that we know work. So thank you very much. I don't know that we're going to have another update before Christmas. If we don't, Merry Christmas to all who celebrate. And we will, given our need to keep the information fresh, may have an additional briefing. Thank you.